So the framework that I like to use in describing what the issue around immigration is the social determinants framework, that we're beginning to understand that it's the immigration status of individuals and families that is really the barrier or the problem, and not their identity as immigrants, as their identity as Central Americans, their identity as Africans, their identity as Asians, coming to this country. It's the fact that our immigration system is very, very complicated, that there are lots of complex reasons why people come to the United States, and then when they get to the United States, that sometimes they're welcome and sometimes they're not for historical reasons, and that each family often has what we call mixed immigration statuses, so that someone may be a US citizen and born here, someone may be undocumented, someone may be in process of getting their green card or their legal status. And so all these become barriers that affect whether or not they can access healthcare, whether they can access housing, employment, education, other kinds of social services. And if we understand from a social determinants framework that we need to work together to remove those barriers so that folks have more access and opportunity, then that evens the playing field for immigrants in this country. But I think it also helps us to understand the challenges that they have to overcome. So I think our future public health practitioners, as well as our future public health providers, have a really, really important role, especially if they're in a practice here in California, in understanding that immigrants are an important part, a significant part of our communities here in California. So if they are public health practitioners, to really understand the needs as well as the assets and what immigrant communities can bring to public health, how they can both address their own issues as well as contribute to larger public health solutions as we think about population health and community health. For healthcare providers, oftentimes we think of one patient at a time, and I think it's always important to actually use the public health principles and think about population health and not just focus on that individual, but understand the context in which that individual is coming to that healthcare provider, the barriers that they're facing, listening to that individual to find out what it is that they need and how that provider could help them, but then understanding that oftentimes those larger systemic and policy barriers, whether it's their status, whether it's their family situation, whether it's the fact that someone in their family just got deported, is going to impact on whether or not they can access healthcare and how they're accessing healthcare. So in this very polarized political environment, it's really hard to talk about long-term solutions, but I do think we need to have a conversation in this country about what it means to be an American, what it means to be an immigrant, the role that immigrants have played historically in this country, those that came involuntarily as slaves, as well as all those that have come voluntarily seeking a better life, fleeing the conditions in their country. And I don't think we should take that conversation lightly. It's a complex policy question of how many people should we be admitting, how many people should we be admitting in what categories. I think there are some principles that we should be talking about, that we should be protecting families and reuniting families. We should be creating opportunities for those that are already here in the United States, whether they're immigrants or citizens, and that we should be having some sense of responsibility for what's happening in the world. So when it's US policies that are causing refugees, for example, causing people to flee their countries because of interventions that the United States is doing, we have some responsibility for that as well. So it's a very complex question, but I think having a conversation about what our long-term immigration policy should be, and then really working with the elected leaders to have the courage to put those solutions in place. I think a one-time fix is never going to be the solution. So simply taking care of the 11 million undocumented that are already here isn't going to prevent future undocumented folks from coming or becoming undocumented. And so we have to have a much, much longer view of what immigration means in this country and how we as a country are going to be thinking about immigrants.
So I think the current problems with regard to healthcare and access to healthcare around immigration policies really have to do with the fragmented processes by which people access healthcare. There are a number of programs that just could be better aligned, and as we really look towards population health and managing health in general in the state and in our country, I think it affects all of us if it affects one of us. And I think that when we align the policies that we put into place to be able to ensure that care is seamless and continuous, ultimately that's where we need to go for everyone. And that really will result in a reduction and hopefully an elimination of the disparities that we see everywhere. I think as healthcare providers, for myself, this has been something I've thought about a lot. And I think now, those of us who've been doing this a long time and who can sort of put our fingers on where we think the problems are, in addition to meeting our patients where we are, we need to see ourselves and our patients and see our patients in ourselves. And what I mean by that is that the patients that I see in the safety net, in the healthcare system that I work in, or the healthcare organization that I work in, those people, particularly the young ones, not all young ones, but the young ones are the people I want to become healthcare providers. And so that is a bigger sort of discussion, I think, rather than just providing healthcare, but also helping them to see the pathway to solve the same problems and to become people that are solving those problems. I think to solve the problems that exist with regard to immigration policy and access to care, I see the problems to being solved in a number of ways, but I think fragmentation would be reduced if we aligned our policies even within counties and states and even in institutions, really, because so frequently we end up with problems that we think are going to get solved by one program, but then it turns out that the opposite is true in another program within the same organization or the same state or the same country. So for example, in a larger picture, in order to receive this benefit, an individual has to do XYZ in a particular way, but then in order to receive the same benefit, they have to come together, and the qualities or the pieces that are needed to meet that to ultimately end up where they need to be are exactly the opposite. And so I think, aligning those policies, just as we think about it from the perspective of both the individual and the population, are really important. So voting, obviously as well, but more than that, really, taking our space and encouraging our patients and everyone to take our space.